and your time starts now.
Hi, my name is Adeline. I'm your student nurse for today. I'm going to do your head-to-toe assessment. Is that okay with you? I'm going to check your IUL. Okay, rental flores. Now I'm going to close the curtain, ensure your privacy and your safety. Now, before we start, do you feel any pain, discomfort? Do you want to use the washroom? Okay. Okay, could you tell me, now I'm going to check your level of your consciousness. Could you tell me your pain? What time is it? Do you know where are you right now? School. Okay. He is alert and oriented by stating the right person, place, and time. Now, for the body structure, he looks stated to be his stated age. Skin color is consistent with the rest of body with appropriate genetic background. Now I'm gonna check your body structure. Can you stand up for me, please? Okay, you can now sit down. Height, he's symmetrical. Height is appropriate to his age. But posture is relaxed. The body position is upright. I don't see any obvious physical deformities. Your behavior is you appear good. He can maintain eye contact to me. Speech is intact. Personal hygiene kept intact. The way he dressed today is appropriate for this weather. Now I'm gonna inspect your face. Your face is symmetrical. I don't see any lesions. Skin is smooth. No deformities, no visible masses. Skin is matches to the rest of your body. Now I'm gonna test your cranial nerve number 7, which is your facial nerve. Can you smile for me? Can you smile with your teeth? Can you frown? Can you pop up your cheeks? Can you raise your eyebrow? Now can you close your eyes? And I'm gonna try open against your assistance, okay? Okay. Facial structure is symmetrical. Therefore, cranial nerve number 7, which is your facial nerve, is intact. Now I'm gonna check your eyes. Your eyes and eyebrows are symmetrical, even upper and lower eyelashes, even distribution. Can you close your eyes? No eyes lid lag. Sclera is china white. Conjunctiva is pink. I don't see any discharge or any crusting. Now I'm gonna test your cranial nerve number 3, which is your oculomotor nerve. I'm gonna measure your it's 3 millimeter in diameter. The other side, okay, it's both round and symmetrical. Now I'm gonna test your direct reflex. Both pupils are constrict. Now I'm gonna test your concise swab. Okay? I'm gonna shine to the right eye, left eye constrict. Now I'm gonna shine to left eye, right eye constrict. Now I'm gonna do the accommodation. Can you look at this one? Both eyes are constrict and converge with direct and conjunctival light. Eyes are reactive to light and accommodation. Now I'm gonna inspect your ears. Your ears is symmetrical. Its skin color is matches to the rest of body. No lesions, no scars. I don't see any discharge or serum in both ears. Now your nose. Your nose is in the midline. No nasal flaring. No discharge or any crusting. Now I'm gonna inspect your lips. Your lips is symmetrical. It's on the midline. It's hydrated. It's appropriate color. I don't see any lesions and any scars. Now I'm gonna test your cranial nerve number 9, which is the glossopharyngeal. glossopharyngeal nerve and cranial nerve number 10, which is the vagus nerve. Can you stick your tongue out? Can you say one more time? Okay, both uvula and palate were able to rise. Therefore, cranial nerve number 9, which is glossopharyngeal, and cranial nerve number 10, which is the vagus nerve, is intact. Now, next is your neck. Your neck is symmetrical. Oh, before we proceed the neck, I'm gonna test your cranial nerve number 12, which is hypoglossal nerve. Can you stick your tongue out one more time? Move side to side. Can you say light, tight, dynamite?
Light, dynamite.
Okay, tongue is in the midline. He was able to move side to side and able to say the phrase with no tremors. Therefore, cranial nerve number 12, 12 is, which is hypoglossal nerve, is intact. Now I'm looking at your neck. Your neck is symmetrical. Head is erect. I don't see any lesions, no visible masses, no deformities. Skin is matches to the rest of your body. Now I'm gonna palpate. Trachea is in the midline. No enlargement. Thyroid, carotid pulse is present. Skin warm to touch. No tenderness. Now I'm gonna test your cranial nerve number 11, which is the spinal accessory nerve. Can you move your head back? Flex your head, side to side. Shrug your shoulders. Can you do one more time against your resistance? You can move this side, the other side. Shrug your shoulders. Okay. He was able to perform both skills with or without resistance. Therefore, cranial nerve number 11, which is spinal accessory nerve, is intact. Now I'm gonna inspect your posterior thorax lung.
Raindell, if you could just sit and face the curtain so
Or
that she
if
can.
it's like,
Can
you
I
just
That's
stand?
fine. That's fine. Yeah, just make sure I can see the back.
Okay,
Yep.
now I'm gonna inspect your posterior thorax lungs. Spine is processed after straight. Thorax is symmetrical, downward sloping ribs with approximately 45 degrees. Scapula is symmetrical. AP diameter to transfer diameter is 1 to 2. I don't see any lesions or any scars. Okay, I'm gonna palpate. Do you feel pain? No tenderness, no masses. I'm gonna put my thumb on T9 my thumb on T9 and T10. Can you exhale? Inhale. Okay. Chest expansion is symmetrical and smooth. Skin warm to touch too. Now I'm gonna auscultate using the diaphragm. Can you breathe in, breathe out every time I move this, if you feel the stethoscope, okay? Okay, no adventitious sounds, no cracking or wheezing, nor more broncho-vesicular sound between the scapula and vesicular sounds over lung peripheral fields. Now I'm gonna listen to your apical heart rate. Can you lay down for me, please? I'm gonna listen to the mitral valve, which is the fifth intercostal left clavicular line. Now I'm gonna listen to the heart rate. Okay, now I'm gonna listen to rate. It's 75 for 30 seconds. It's 75 beats per minute, regular, and 2 plus. I heard normal S1 and S2 sounds. Now I'm gonna use the bell for if I heard any extra sounds. No S3 and S4 are present. Now I'm gonna inspect your abdomen. Now I'm looking at your abdomen. Your abdomen is symmetrical. Umbilicus is in the midline. No lesions or any scars. No stretch mark. Contour is present as flat. No sign of any hernias. The hair is diamond shape. Now I'm gonna auscultate from right to lower quadrant. Bowel sounds are present in all four quadrants, approximately 5 to 30 seconds per minute. There is a high pitch, there is a cascading and gargling. Now I'm gonna palpate using my forefinger. Do you feel any pain? No tenderness, no masses, no superficial, skin warm to touch, no voluntary guarding, no rigidity. Now my head to toe assessment is